This is the Emergency Medical Minute.
I have a medical minute about opioids, so sorry for everyone who thinks I'm going to talk about something else. What is the chance that your patient who comes in with an opioid overdose is going to die in the next year? What? It's not 50%. Come on, Amicia. It's 10%. So it's 10% in the next year that patient would be dead, and it's 5% in the next month, okay? So just for frame of reference, what's the chance that your patient who comes in with a STEMI is going to die in the next year if they go to cath lab? 7%, right? So you're talking about a disease of really 20, 30, and 40-year-olds that's every bit as deadly as a disease of 70 and 80-year-olds who come in with heart pain, right? And it just goes to show you kind of the importance that we have to take care of these patients and do so in a better manner. We have a few tools that we have here that I want to remind everyone of because I think we're underutilizing some of those. So we're only the second place in the state that has a take-home naloxone program. So if you have a patient who's either abusing opioids, be it IV or otherwise, make sure that you talk with your doc about sending them home with naloxone, okay? If you have someone who you're prescribing a benzo and an opioid to, they should definitely be prescribed naloxone. So the first thing we can do to decrease mortality is get them home with life-saving drugs. The other thing that we're going to be doing probably in the next few months, which you'll be hearing a lot more about from nurse training, et cetera, is we're going to start a buprenorphine program so that when patients come in and they're in active withdrawal or they want help with treatment, you're going to see probably in the next few months your ER docs and PAs ordering buprenorphine for patients. So we'll all need to learn how to use this medication. But again, this is one of those things where if you treat patients with opioid use disorder with buprenorphine, you decrease their mortality by over 50%. So it's a huge, huge lifesaver and something that I'm excited for us to be providing very soon. Okay, cool. Go team.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.